Okay, here's the part of our video that every parent looks forward to the most. Well, not really, but it's something we really need to put a strong focus on anyway. Yes, it's time to change the trach. Before we show you this process, keep in mind that it is okay to be intimidated by it, especially the first few times you do it. You are dealing with your child's airway, so it is important to take it seriously. Keep in mind that this will not hurt your child and it will be over within seconds. The best way we can describe this process is that it is like changing an earring, but obviously this involves much greater risk. First off, it's important to get everything you'll need in one area so you can reach it easily. When performing a planned trach change, you should have 2 people present. If you have a home care nurse like we do, the nurse would be the best choice as your second person. The most important item you'll need is your new trach. For most infants, the trach package typically consists of only 2 pieces. The first object being the trach itself, and the second piece being a thin, Q-tip shaped curved rod called an obturator. You will also need a water-soluble lubricant, a new trach tie that has been measured and cut, a half-strength peroxide solution, 4x4 gauze pads, and a fresh split gauze. It is also important to have an extra trach that is an X size down, oxygen, and a foam within reach in case of emergency. You should do your trach change at a time when your child is calm and happy, which will make the trachea more relaxed. However, don't be surprised if your child becomes a little agitated during the process. This is pretty normal. It's very important that you've washed your hands so they are free of dirt or germs. First, insert the obturator into the trach tube. Then, sparingly apply sterile lubricant to the end of the obturator. The obturator is designed to provide a smooth surface that helps guide the trach when it is being inserted. Remember, you should only ever hold the trach by the connector at the top of the neck plate to prevent contamination. Never touch the cannula directly. Now you should undo the Velcro straps from your child's existing trach. With your thumb and forefinger, carefully remove the entire tube in a straight outward and downward motion. The trach should remove without too much effort. Don't be surprised if during the few seconds your child has a trach out, if he or she coughs mucus out of the stoma. This is normal. Instantly insert the new trach using gentle pressure in a forward and downward movement. It is common to feel a minimal amount of resistance due to your child clamping down. If your child clamps down so hard that you cannot get the trach in, try again using the smaller trach. If that doesn't work, call 911 and follow your physician's specific instructions. Once the trach is in, you should quickly remove the obturator so that air can flow again. Next, insert the Velcro band of the trach tie through the loop on the trach's neck plate. Then slide the length of the tie behind your child's neck and fasten the remaining Velcro band through the loop on that side of the neck plate. Clean the stoma and surrounding area with your gauze, Q-tips, and half-strength peroxide solution. Once finished, you can clean the used trach with your half-strength peroxide solution and save it for future use. You should store it in a clean container with a lid. We saved our used trachs and provided them to family members and friends, so we had emergency trachs available at locations that we visited often. And that's all there is to it. I know it may seem stressful at first, but once you've done it a few times, your confidence will increase and it will not seem like so monumental a task. After all, if your child can handle it, then so can you. In the previous sections, we have shown you the ideal situations for proper trach care. However, each insurance provider has their own set policies on what specific supplies they will provide and the amount they will provide. It is up to you in your role as your child's advocate to take an aggressive stance in making sure that your insurance company provides you with the supplies you need. There will be times when your child may need more supplies than normal due to illness. Don't accept no as the final answer. If you need to get your doctors involved to write specific prescriptions, or you need to call multiple times each day till you get what you need, then do it. The squeaky wheel gets the oil. Your child is depending on you.